if you know that you have never broken any of your bones in your life before, like me, can you say hi in the comment section? Myself, number one, I have never broken any of my bone before. But today I want to talk to you guys about fractures and dislocations. So a bone fracture is basically a break in your bone. It could be a complete break or it could be a partial break in your bone. And it could be caused by some diseases that weaken the bones, overusing your bones, and also trauma to the bone. When I say trauma, I mean maybe when you get yourself involved in a car accident, when you fall down, when a strong force hits your body, or when you engage in sporting activities and you get yourself injured. Yes, all these things could cause bone fractures. Now, dislocation on the other hand, or joint dislocation, is when a bone in a joint is forced out of the normal position. And dislocation could also be caused by trauma, car accidents, when the person falls down, when a strong force hits the body, or when the person gets injured during sporting activities. Now, what do? Immediately you have a bone fracture or a joint dislocation. Firstly, the injured person needs to stay still. Don't try to move your body, don't try to stress the affected area and all that. Secondly, if there's any bleeding, try to stop the bleeding. Cover the wound and then check for any other fractures. Thirdly, you need to put a splint on the fractured limb so it don't move around. And also, you need to bandage the limb, not too loose and not too tight, so that it can hold the splint in place and it can prevent the movement of the joint above and below the fracture. And lastly, you need to take the person to a hospital so that the person can see a doctor, get an x-ray done and get treated. And mind you, fractures occur mostly in long bones. But that doesn't mean your skull cannot be fractured though. And also, fractures are very painful. Very, very painful, which is why you don't try to stress the fractured area. You don't try to put pressure on the fractured area when it occurs. The injured person just needs to stay still while they attend to that person. Now, dislocations on the other hand are also very painful, just like fractures, and it makes it hard to use that particular joint that is affected. Now, the parts of your body that are always commonly dislocated includes your fingers, your shoulders, your elbow, your knee, your ankle, and so on. Now, what do? Immediately you have a joint dislocation. Number one, go and see your doctor. Go and see your doctor. The most important treatment for a joint dislocation is putting the joint back in the correct place, which is what your doctor is going to do. Now, your doctor or your healthcare provider would carefully pull or push the joint back into the normal alignment. Please don't try to do this thing by yourself. It's very painful. Do not try to reposition your dislocated joints by yourself. It is extremely painful. And also, please don't allow anybody that is not a healthcare provider or a doctor help you to reposition your dislocated joints. Please, for safety reasons, do not allow it. Now, if this information has helped you in any way, kindly subscribe to my YouTube channel, click the like button, click the share button, share to your friends and family, and let us all be informed. Thank you.